This is lab assignment number 3, thorax and lungs.
My name is Jeffrey Williams, and I consent to be recorded in a video for this assignment in class.
After collecting my subjective data with this patient, I asked the patient to sit upright in a chair. To be able to examine, palpate, auscultate, and percuss both anterior and posterior sides of this patient, I asked the patient to either raise his shirt or put on a robe. Upon visual inspection of the patient's anterior chest, I note the posture and the relaxed breathing technique and make sure that his chest expansion is symmetric, as well as making sure that the spinous process in the back is aligned and has a straight shape. I'm going to inspect for any lesions, any skin discolorations, and any other abnormalities. I will note the circumference of the chest wall, as well as ensuring that the ribs slope down at a 45-degree angle evenly and symmetrically. I'll begin by palpating the chest expansion of the patient. I'll begin by placing my thumbs toward the xiphoid process and ask the patient to take a slow, deep breath. I will note my thumbs expanding symmetrically, as well as the smooth chest expansion. Now, with the patient face the other way, I would palpate the posterior side of this patient. I'll take my thumbs and I'll place them around the area of T10 and ask the patient to take a deep breath. I'll note the expansion of my thumbs in a symmetric order and also noting any pain that is associated with this deep breathing. Next, we will be evaluating for tactile fremitus. I'll begin by taking the ulnar sides of my hands and placing them at different levels on the patient's posterior back. I'll then ask the patient to repeat the word 99 or blue moon repetitively.
99, 99, 99, 99, 99, blue moon, blue moon.
While palpating for tactile fremitus, I would be noting the symmetry of vibrations, vocal vibrations on each side, as well as the intensity of the vibrations. I will note any absent or abnormal findings, as that can be associated with pneumonia and other thoracic lung conditions. Next, we'll be repeating this on the front side. Again, we'll be taking our ulnar side of our hand for the anterior tactile fremitus test. We'll ask the patient to say the word blue moon or 99 four times.
Blue moon, 99, blue moon, 99.
Next, we'll be percussing the anterior and posterior chest of this patient. While percussing, we will be evaluating the pitch, dullness, resonance, and any asymmetry that is found in any of the lung fields. To begin, we'll place our fingers and our hands on the top of the chest wall. We'll be using our other two fingers to hit the middle finger right in between the first and second joint. Place firmly and tap twice. Move locations, tap twice again. We're going to do this symmetrically on each side. We'll repeat the same percussion on the posterior side. While percussing, we'll be moving at 5 centimeter intervals. Next, we will be assessing for diaphragmatic excursion. This begins by percussing all the way down the scapular line and noting the border of the lower lungs of the lobes. First, I'll begin by asking the patient to take a deep breath in and hold it. Then I'll begin percussing all the way down until I note the change in sound. Then we'll ask the patient to exhale all the way and hold it, then repeat the process. The difference between the two assessments is approximately 3 to 5 centimeters. We'll repeat this process on the other side. Ask the patient to inhale, take a deep breath and hold it, and percuss right there. Then we'll ask the patient to exhale fully and hold it. Next, we'll be auscultating lung sounds of the posterior side of this patient. We'll be noting normal breath sounds, any vocal sounds, as well as the pitch and the quality of each deep breath. I'll ask the patient to sit slightly leaning forward with their arms resting comfortably in their lap. Next, I'll ask the patient to take slightly deeper breaths than they are used to. I'll ask the patient to notify me if they need a break or if they begin to feel dizzy. Deep breath. I'll be going symmetrically, both sides, side to side, to compare breath sounds. I'll be noting the pitch, any wheezing, any absent lung sounds, as well as any advantageous breath sounds as well. Any crackles that are present, and any asymmetry. Next, we will be performing auscultation on the anterior portion of this patient's chest. We'll first ask the patient to breathe through their mouth slightly deeper than they are used to. We'll ask the patient to notify us if we need to stop, if they feel dizzy. That concludes lab assessment number 3, assessment of the thoracic and lungs.
Thanks for watching.
Thanks for watching.
My name is Jeffrey Williams, and I consent to be videoed to be recorded.